Everything I do is very subtle. It just needs a little enhancement, and that's what I like doing. It's like taking a Rembrandt and just kind of fine-tuning it and restoring it. If you break it down in plastic surgery, it's about the face. My goal is always, anything I do, whether noses or injections with Botox, I want the movement. I want everything to look natural, and I think there lies the art, and it distinguishes one doctor from another, one surgeon, one artist from another. Give me a frown. So you have some lines, but not a lot, so I'm going to do very, very soft Botox there. You have a little bit what's called beginning of crow's feet. Not bad at all, but it's nice to be able to erase or soften these lines before they get deep. What I do is I take my marking pen and I draw dots for where I want to put Botox and why, and I draw lines for where I want to contour the face and inject hyaluronic acid. When you smile strong, this muscle is called depressor anguli muscle. It wants to pull the face down. So again, very soft dot of Botox right there, soft dot of Botox there. These are 3 sets of muscles. This is one. Second set of muscle is here. This is the third set of muscle, and this is called the depressor muscle. Depresses the angle of the mouth, so it'll give you a soft Botox. You have beautiful vectors, high cheekbones, and I see that right there there's a little tiny flat spot, and I could use a couple of drops of Juvederm there, a couple of drops of Juvederm there, and maybe a couple of drops there. Botox, it takes about 6 to 7 days for you to begin to see the results of what Botox has accomplished. But fillers, you see instantly. So you do one half of the lip or one laugh line or one side of the cheek, and it's great for me to give the patient the mirror and say, look at it, look at what we've accomplished in 10 minutes. And when they see side by side what has happened, whether it's a lip or the cheek, it's fascinating. So look at how tiny this needle is, huh? Just barely you can see it. It's a special needle, I get it from Italy. Just very smallest, thinnest needle. So the tremendous advantages with this needle, because you can be very precise. Doing very well.
How long does it take for the full effect of the Botox?
Takes about a week. You know, you can begin to see the benefits starting in 5 days, and lasts about 3 to 4 to 5 months. So now we're going to do a little bit of filler on the cheek, and so let's do, and I'm going to show you, I'll do one side. The filler effect, that's great, you know, you can see right away. Juvederm is hyaluronic acid. Hyaluronic acid is a natural substance. What I like about it is it's reversible. Say for instance, you do 100 patients and a patient says, oh, but this is too much here. You know, I don't like, there's a little bump here. You can neutralize it immediately. There are other fillers which are good, but they don't have the reversibility. You're doing great. Open your mouth. So now I'm doing is just massaging it for you and smoothing it out. So we're done with, you see the comparison, the laugh line. I haven't filled it all the way. I don't like to fill it all the way. But you see, the vector is so much better. Why look old and then young? Why not prevent it? So whether you're preventing the loss of volume with hyaluronic acid, or preventing the lines with Botox, or enhancing the lips with hyaluronic acid fillers, you know, in my opinion, it's good to start early. See that little flat spot right there? That's gone.
Yep.
And look at this vector right there, from starting from the upper edge of the lip, coming all the way up there, and it complements your lower vector, and then this is a sculpted face.
Very sculpted,
so if you do it right, the camera bounces against here, bounces here, and this is a sculpted look. So that's what we want to preserve. So whether you're 30 or 40 or 50, there's always this goal to preserve and strengthen this vector from the outer cheek, middle cheek, frontal cheek, coming into the laugh line, into the mouth. So this is the line, and this is the strength you create. As we age, what happens, we lose our baby fat either in the front of the cheek or the middle of the cheek or the outer cheek. And what we're doing with you, you're young, we are before you start to lose the baby fat. We are keeping it lifted. So it's a combination of a little bit of Botox, a little bit of filler, and so that just preserves the vectors and preserves the contour and the volume, so it does not, sink in. Face is what we show to the world, and you can say that it's a very superficial way of looking at it. Why should there be so much emphasis on the face? But the reality is that there has been emphasis on beauty all throughout the history.
Is there something else to keep the top of the surface of the skin stimulated, looking fresh?
Yeah, good skincare, like retinol, the Ayurvedic retinol, that's very good. And so that it's so micronized that it penetrates through the pores and it just polishes the skin. So 2 nights a week, if you can do that. So it's a micro-exfoliation and it stimulates the collagen formation and the new cell formation. Keep it youthful, enhance it wherever you can. But the art lies in the fact that it should look like you were born with it. Nothing should look like it was touched.